Western Maryland. It's very mountainous and rural. A lot of people live remotely. They just don't have public transportation or they have no reliable vehicle of their own. It's a very high poverty area. The Merck Foundation was really instrumental in giving us the funding that allowed us to get the best care for our patients with diabetes in the community. It's really important to provide the resources when the community comes to us. Western Maryland Health System developed a chronic disease clinic, the Center for Clinical Resources, that will help patients navigate their own disease process. We have embedded in the clinic patient assistance should they need that. We have care coordinators really specifically trained on diabetes and addressing those barriers, and they have been able to make connections with patients that no one else really had time to do or even thought that we should be doing at that point.
Because it is one place where patients can sit as long as they need so that we can understand not only their chronic illness, but what their goals are. Our podiatrists are shocked. One of them, he says, "I couldn't believe it when I looked at their feet." I said it's our Center for Clinical Resources. It has enabled us to catch patients sooner. My job is to help keep people out of the hospital, and we're able to do that.
By having the Center for Clinical Resources and having our nurse case manager reaching out to the patient, making phone calls, following up with them, and then further delineate what care they need from there, whether it be a diabetes educator, a dietitian, a social worker.
They will work very closely to develop a treatment plan. And that can involve education, but it also can involve medications, technologies. We have a very high percentage of low literacy in our area. We have maps that we use for our education. We do visual food demos, let them understand what we're talking about rather than just giving them handouts with lists of foods. Patients are thrilled with having our food pharmacy program. One of the biggest barriers that we have found is food insecurity. So people who lack access to healthy food. We provide fresh produce, proteins, things like that, and then they improve clinically. They are just so happy to be able to get that good, healthy food that they weren't able to get before.
We're constantly trying to come up with new and innovative ways to keep patients engaged. We have community events where we speak very highly of our programs available to patients.
It's very important that we build community events that the patients will go to, because they won't come unless they see that it's something for them. We've developed a program called the Hometown Healthy Partnership. We've partnered with 7 or 8 other community partners, and we go out to functions that are already in place. We go to chicken dinners, we go to steak feeds, we go to bingos, and we think that if we're out there, they'll come because they're getting used to our faces, they're trusting us. We're also going to be going around with our partners to 12 different locations in the county, and we're going to do mini health fairs out there, food demonstrations, things like that. That allows us to go out with our partners and engage with people that we normally wouldn't get to see.
I think it's really important for us to meet the community where they are, and that we don't seem to be just all about when you're sick. We want to get to you when you're healthy. Sometimes you're just getting set up, and one of the patients that I've been seeing for a couple of years will come up and say, "Oh, you're here, and you'd be so proud of me." It's what makes doing what I do matter. Bridging the Gap funding has really allowed us to do a lot more community outreach than some other health systems are able to do, because this has given us the funding, it's been able to give us the support in the community, and other places don't have that.
The Merck Foundation Bridging the Gap was a real game changer for us, because that enabled us to have the different programs that have made our patients more healthy.
Often people are too proud to ask for help. Now we're actually going out and doing an assessment of what barriers do people have, and saying, okay, you have these barriers and we have resources that can help you. So let us help you.